Medicamentosus allergy. There is connection with use of drugs. The relief goes after the disposal of drugs. We use immunoferment immunoenzyme method of detection of specific immunoglobulins E to the drugs. We use detection of tryptase S serum, tryptase, reaction of inhibition of leukocyte migration, reaction of blast transformation on lymphocytes, method of multiple chemiluminescence, method of kali potassium ions release, test of activation of basophils, test of transformation of lymphocytes. There is classification of types. The first type is immunoglobulin E mediated anaphylactic shock, urticaria. The second, immunoglobulin G and M mediated hemolytic anemia, leukopenia. Immunoglobulin G or M mediated, this is serum disease, eczema. The fourth A type, this is cell type. It's mediated by T helpers 1, they activate monocytes, this is contact dermatitis. Fourth B cell type, T helper 2, they cause eosinophil inflammation with bullosis deformations of the skin. Fourth C cell type, when CD4, CD8 react and cause cytotoxic changes of the skin, the contact dermatitis. We also use provoke tests by skin on the skin when we use 1 to 10 dilution or undiluted allergen, and then we use a scarification test 0.02 milliliters. We inject 1 to 10 dilution and intra skin when we use 0.02 with 1 to 100 dilution. Then we also use oral test. It's like in vivo test of reaction of inhibition of migration of leukocytes. We use Hansen violet spirituous solution in acetic acid when we count leukocytes in the chamber of Gareev, and we calculate in 50 cells, and there is distraction between the first portion of the number of neutrophils and the second portion and third portion, the medium value, and positive reaction is when there is decrease of neutrophils in the second and third portion on 30% and more. Norsulfazole is used in 100 micrograms per 10 milliliter, and other drugs in 1,000 units per 10 milliliters of normal saline.